Knock, knock, knock. Hello, my name is Jack. I'm a student nurse at Eastern Michigan University. I've come in to do a head-to-toe assessment on you. And when I come in, I'm going to do my proper hand hygiene. And then I will also look at her and I can see that she is well-nourished, well-developed, and not in any acute distress. So I can proceed with the examination, and I'll start by asking her some questions. Hey, what is your name?
Alyssa.
When were you born?
11/20/97.
Who is the current president?
Joe Biden.
And do you know why you're here today?
I'm here for a physical exam.
Awesome. So I would say that she's alert and oriented ×4, and then I can also say that her speech is clear. From there, I can go to assess her strength, and I'll get down here with her. Maybe push against my hand. And push up. Pull. Push. Grasp. Alright. And pull. Push. And up. Down the gas pedal. Awesome. So I would say her strength is a 3 out of 5, which is what we're looking for. And then from there, we can move into her sensations. We'll use the soft and sharp, and I'll explain to her, this is soft, this is sharp. So I'm going to have you close your eyes, and I'm going to touch different parts of your extremities, and I want you to tell me which one I'm touching you with and where, okay?
Soft lower right arm. Sharp lower left arm. Sharp lower right leg. Soft lower left leg.
Awesome. So she did good with that. So I would say all of her sensations are intact bilaterally on all her extremities. And then from there, we can go for her reflexes. And I'm going to start with her tricep, which is going to be her C7. Try to get nice and loose. And I'll go to the other side to compare. And then I'll go down for the bicep, which is going to be C5 and 6. I'll hit my own thumb. And I'll go to the other side. Try to keep it nice and loose. And then we'll go down to the radius, and this is going to be C6. And we'll go to the other side. Alright, and because her legs aren't hanging, we're not going to see too much of these reflexes, but this is her L4. See a little bit. And then we'll go to the back side for S1. Other side. And then we'll go to the Bushinski, which is going to be on the bottom of her foot. We can see her toes start to curl in. And that's what we're looking for. So we would say all her DTRs are intact, and so is her Bushinski. And then from there, we can move into her gait. So I'm going to have you stand up. Alright, then I'm just have you walk that way. And I'm just going to be watching her walk, and then back on your heels. And then back that way on your toes. And then I want you to go heel to toe just like this. Good job. You can have a seat. So I would say that she has a normal gait. She doesn't have any problems with that. She's not favoring either side. And then from her gait, we can move into her HENT assessment. And so I'm going to use the pen light. There's going to be a bright light in your eye, okay? Alright, so Perla is present, which is what we're looking for, and then we'll look at her nose, and there's no flaring, so that's what we want as well. And then we'll look at your mouth. Open, good job. And for that, we're going to say that her there's no circummoral cyanosis, and that her mucous membrane is pink and moist, And then there's also no pursed lip breathing. And now we're going to go down to her neck. I'm just going to push your hair back. And we can see that there is no accessory muscles being used, and that there is also no jugular vein distension. And from there, now I'll palpitate her carotid. All right, and I could feel no thrills. From there, I'll listen to her carotid with the bell of the stethoscope. All right, so while I do this, I'm gonna have you hold your breath. All right, you can breathe. All right, hold your breath. All right, so there, I'm gonna say there's no bruits, so all that sounded normal. And then we move on to her chest, and I can see that her chest looks normal. There is no barrel chesting or any pectus or signs of scoliosis. And then I can also see that she doesn't, if she had her shirt off, I could see it better, but there's no intercostal compressions, and she doesn't appear to have any respiratory problems with her breathing, and she is not tripoding. So from there, I can feel the 4 spots on the front, and then the 6 on the back. I'm just going to move your hair to the side. I would say that there is no abnormal vibrations, so everything looks good there. And then we'll give her lungs a listen. We'll listen to the opposite sides to compare. Then I'll listen to the 8 spots on the back. Just take a nice deep breaths. And then I'm gonna have you lift your arm so we can listen to the 3 spots here. So from there, I can say that her lung sounds are clear, both A and P, and that there is no crackles or any thrills there. So her lungs sound good. And I'll move on to more her heart side, and I'll see her chest, and I can see that there is no heaves. And then from there, I can feel the 5 regions. All right, so there I'm not feeling anything abnormal, like any abnormal vibrations or anything like that. So I can go and listen. So her heart sounds good. It's a regular rate and rhythm, and I can hear S1 and S2, but I don't hear any murmurs or the S3 or S4. So I would say that her heart sounds are good. And then from there, I'll move on to her capillary refill. So can I see your hands? Can I see both your hands? So I'll just pinch here and look for less than 2 seconds to return to normal. And the feet too. And they do, so I would say that her capillary refill is good and +3 in all her upper and lower extremities. So from there, I can move on to looking for edema, where I can feel the bony prominences all the way down. I can do it on the legs too, all the way down to the feet. And I would say that there is no edema, everything feels normal. And then I'll go on to feel her pulses, which I'll go from the back just to not block the camera. I'll feel the brachial pulses. And then I'll feel the radial pulses. And then popliteal pulses. And the tibial. And the dorsal. And all of those feel normal. And they're all present, which is what we're looking for. And so we go from there. From all the pulses, I can feel for warmth in her extremities. So I'll feel with the back of my hands all over, just to make sure she feels warm. There's no cold spots anywhere. And she feels warm, so that's going to be good as well. And now we can go on to assess her abdomen. So just to take a look at it, we'll lift her shirt up. And we can see that there's no bruising. It doesn't look like it's distended at all. There's no veins around the umbilical area that are distended or out of place. So I would say that upon inspection, her abdomen looks good. And then we are going to listen for her bowel sounds. In all 4 quadrants. Just have you move your hands here. And we would listen to these areas for a full 3 minutes to make sure that there is, to make sure we have an accurate representation of her bowel sounds. So I would say that they're normal active in all 4 quadrants, which is good. That's what we'd like to see. And then we are gonna take some soft palpitations, and we wouldn't want to touch anything that's distended or tender. So we would just feel all 4, and we're gonna note any masses or anything we feel. And everything felt good and normal there. Nothing was too tender, nothing felt distended. And so from here, we could do this when she was laying down, but we can do it her sitting up. We'll percuss each of them. So we'll hit the back of my fingers here to get the sound. And all those sounds sound normal as well. There's not we don't hear any masses or anything in there from the percussion. So I would say that her head to toe looks good, and I could document all my findings and in her chart, and then I would ask her if she needs anything before I go.
I'm good.
All right. So then we would be all done with her head to toe.
Thank you.